Good morning, Casi.
Good morning, Shane. How are you?
I'm good. Couple of questions this morning. What are some of the things you're doing to help prevent strokes in our community?
Well, since May is National Stroke Awareness Month, I'm really excited to be able to talk to you about this today. So Maui Health is a primary stroke center, and community outreach is very important to us. And some of the things we do is, of course, we attend many of the outreach events across the island to offer information to the community on stroke. We're actually offering a stroke awareness class this month on May 17th at the Kaunoa Senior Center. But one of the things that I'm most excited about is our partnership with American Medical Response to teach Be Fast to our Maui fifth graders.
Be Fast. Awesome. Casi, many adults, they don't want to deal with this. Like, oh, I don't want to think like that. I don't want to, think about strokes and stuff like that. So it is very, very important that we reach our children and start from when they are young. Why do you think it is important to teach our children Be Fast?
Well, since multi-generational living is kind of one of the norms now with the cost of living being so high, it's really kind of a big deal to teach our kids to recognize signs of stroke because usually they're living with somebody over the age of 65 now. And if you remember the whole effort of Stop, Drop, and Roll, it was extremely successful, and that's kind of the idea behind Be Fast. And when kids go home after they learn these things in school, they teach it to their siblings, they teach it to their family members, and kids remember this stuff, and they'll remember it as they grow up and they start to, become people of that age that may have those symptoms themselves, and hopefully they've picked up on these ways that we teach them on how to prevent stroke too. So we're hoping that these kinds of things will settle in, and as people grow, they start to learn these things and they integrate them into their health regimens and things like that. So we're hoping that it works out just as well as Stop, Drop, and Roll did.
Well, we got a good model to model after with the Stop, Drop, and Roll, because we both still remember that as children,
Exactly.
Still in our young age today. We're still in our young age, Casi, but we remember the effects, it's etched in our brain and memory. And yes, I believe this is a very important program and narrative to put in our children. Be fast. Stop, drop, and roll, and be fast. I love it. Awesome.
Yes.
Casi, how long does it take to recover from a stroke? And can you be treated right here on Maui?
Well, I'll answer the first part of the question first, second part of the question first.
Okay.
Excuse me, and that is yes, you can be treated on Maui. As I said before, we're a primary stroke center, so we offer lots of different services here at the hospital. We're able to give, for the clot type stroke, we're able to give that clot busting medication, and we're actually only one of the two centers in the state of Hawaii other than Queens that is able to offer the mechanical thrombectomy for large vessel occlusions. So yes, absolutely, we can treat you here on Maui very well. As far as the recovery from stroke, that's very dependent on the timing and when you come into the hospital. And that's one of the reasons why we teach Be Fast, because we want you to get here as quickly as possible, because the sooner that you get here for stroke treatment, the better treatment you get and the less devastating that the stroke will be and the better recovery you'll have. So that's why we want to teach everyone to get to the hospital as quickly as possible, because we can help reduce the disability that people can have from stroke if you get here as quickly as you can, because we're able to treat better. Nice.
Such an important program, the Be Fast program. Casi, thank you so much for amazing answers this morning. So crucial, this subject. And like you said, May being Stroke Month, bringing the awareness to everybody. Casi, thank you for calling us. We'll talk again, all right?
Thank you so much. And there's more information about stroke prevention on our website under health tips at mauihealth.org/health tips. Thank you so much. I appreciate it.
Awesome. Take care. Have a good day. Aloha.
You too. Bye-bye.
Casi Saranillio.